Hey everyone! Welcome back to Nurcentric. Let's talk about something every nurse, CNA, and healthcare worker knows too well. That aching back or throbbing feet after a 12-hour shift. If you finish your shift feeling like either your back is on fire, or your feet are about to collapse underneath you, you're not alone. So today, I'm digging into back pain versus foot pain. What hits us hardest as nurses and why? Then I'll share practical recovery tips you can use right away. Did you know that in multiple studies, nearly 80 to 85% of nurses reported lower back pain in the past year? And when it comes to foot and ankle pain, some research shows that over 50% of nurses have reported issues. These aren't small aches. They impact your focus, your mood, and even patient care. So, here's why your back hurts. When you're lifting patients, leaning into the bed, and bending over charts, your lumbar spine and hips take the pressure, and microstrains add up. One study found that nurses without assistive lifting devices were twice as likely to report back pain. Simple shift habits like leaning forward for charting, or lifting without help can make a big difference. Therefore, use a small lumbar cushion, adjust your station height, and do a 30-second back extension stretch between patients. Even that short break helps. Now about foot pain. We walk thousands of steps, stand on hard floors for hours, and wear shoes that often compromise support. One cross-sectional study found nurses working long hours and standing a lot were more than twice as likely to experience ankle-foot pain. Foot pain may start as subtle fatigue, but can grow into plantar fasciitis, heel pain, or even serious disruption of your work life. Therefore, rotate your shoes every 2 shifts, use supportive insoles, and stretch your calves or feet when you sit for a second. It reduces foot fatigue and improves recovery. So which one hits harder? Backache or foot pain? It depends on your role, but here's what matters. Both are warnings that your body needs recovery. If you're a heavy lifter, back pain might dominate. If you're on your feet all day, foot pain might win. Thus, here are 2 universal nurse fixes for you. 1. Hydration plus movement. Because dehydration amplifies muscle fatigue everywhere. And 2. Break microsessions. Even 1 minute of movement or stretching every hour reduces strain significantly. Prolonged standing or static postures raise injury risk. Change one small thing this week. Maybe you can switch shoes, or add 1 stretch before rounding. Thanks for watching. Now I want to hear from you. Does your back or your feet hurt more after a shift? And what's the one thing you're going to change this week to fix it? Drop it in the comments. Don't forget to like, subscribe, and share this with another nurse who deserves pain-free shifts. Your health matters as much as your patients.